We're going to quickly look at another complication of hypertension. And this complication of hypertension is sexual dysfunction. So I once saw a doctor where under he was talking to a patient, and when they reached his side, he was not saying, that thing we spoke about. Like sorry, the patient shaked him. So he was not saying, that thing we spoke about, he improved. Madam was happy. So I just knew that probably they were treating him and his erection was now improving and he was able to, make love with his wife, you understand? So sexual dysfunction is quite disturbing, okay, especially for a man who is not able to, gain erection again. So hypertension could actually lead to sexual dysfunction and it affects both men and women. It's not only men. So mainly it is coming in because vessels, the blood vessels are getting damaged. Hypertension weakens your blood vessels. Okay, so it weakens your blood vessels. So how does this hypertension cause sexual dysfunction? So the blood vessels, the high blood pressure over time is making the blood vessels stiff. It's narrowing them. It's reducing the amount of blood that is entering to them. I know that for you to attain an erection, you need your blood vessels to be engorged. The endothelial dysfunction. So hypertension lowers nitric oxide availability. So this will impair smooth muscle relaxation, which is needed for what? Erection or even vaginal lubrication. So the issues that women with hypertension primarily face is they usually have a dry vagina. So hormonal changes. So that hypertension will cause what? Testosterone deficiency. It will cause estrogen imbalance in women. It will affect even the desire for sex. It affects it. The psychological impact is you're always stressed, you're always anxious, and your other partner, if they don't have a knowledge of what you're suffering from, they might feel like you just want to intentionally deny them sex, that kind of thing. So, especially in men, they have erectile dysfunction and they also have ejaculation problems. So, the ejaculation could be delayed or impaired, you know. And also, medications like diuretics can lower your zinc, and this zinc is needed for testosterone. Okay, so somebody that is under that zinc therapy will generally what have low interest for sex, and the erectile dysfunction is further worsened. So for women, there's reduced arousal and libido. Your wife is no longer interested. Vaginal dryness, so there's painful sex. That's if you guys don't use lubricants like the KY jelly. You know, and difficulties reaching orgasms. Okay, and drugs like beta blockers are most strongly linked to female sexual dysfunction. None of that. So this is the primary thing that causes issues there. So the blood flow is reduced greatly. Do you understand? So you can't achieve an erection with a blood flow that is not intact. So role of antihypertensive medications is for diuretics and older beta blockers. Their side effects usually causes what? A drop in your sex demand. Newer beta blockers, those ones no problem on your sex demand. Angiotensin inhibitors and angiotensin receptor blockers, they are neutral. They're also even beneficial. The calcium channel blockers, they too they don't really cause sex dysfunction. So clinical importance is 58% of hypertensive men to be specific. Women issue is basically libido and also dryness. Okay, this can be solved by a lot of means, you understand? Okay, using lubricants and talking your wife out. But for men, this erectile dysfunction is actually one of the craziest things they face. So it's not only a complication, but it's actually a predictor of future cardiovascular disease. So a man that has a hypertension, this hypertension is tilting into what do they call it? It's tilting into sexual dysfunction, erectile dysfunction. You know that what this man is tilting towards, you know, cardiovascular disease.